This week on Talk with Audrey, Kisqali was recently approved by the FDA to help reduce the risk of cancer coming back in a broad population of people previously diagnosed with early breast cancer. Joining me, a participant in the clinical trial and breast cancer survivor, Asli Gonzer, and her oncologist at the Orlando Health Cancer Institute, Dr. Nikita Shah. Dr. Roxana Mehran from Mount Sinai Health Systems has information about the clinical trial process and Librexia, a comprehensive clinical program covering a number of cardiovascular diseases. Chief of the Allergy, Immunology and Rheumatology Division of Rochester Regional Health, Dr. Shahzad Mustafa, and Margaret, whose 16-year-old son Matthew lives with food allergies, join me with ways to mitigate risk if you have a food allergy. And it's all coming up this week on Talk with Audrey, insightful, intelligent, and inspiring conversations and information to help you improve the quality of your life. It's all about the business of living. I'll be right back. This is Talk with Audrey. Welcome back. Breast Cancer Awareness Month is the perfect time to debunk some myths and share the latest advancements in the fight against the disease. One persistent myth is that after completing initial treatment, that's surgery, chemotherapy, and radiation, that patients are done with cancer. But that's not always the case. Joining me today to talk about Kisqali, a therapy that was recently approved by the FDA to help reduce the risk of cancer coming back in a broad population of people previously diagnosed with early breast cancer, Asli Gonzer, a breast cancer survivor who participated in the clinical trial, and her oncologist at the Orlando Health Cancer Institute, Dr. Nikita Shah. Welcome.
Thank you.
Thank you.
Let me start with you, Dr. Shah. Give us a broader understanding of exactly what early breast cancer is.
So early stage breast cancer is when the breast cancer is localized just to the breast or maybe in the lymph nodes, meaning it has not spread to any other parts of the body. And this distinction is important because early stage breast cancer is curable and we treat it with a curative intent. So typically this is treated with a combination of some form of surgery, chemotherapy, in certain cases radiation in some cases, and then a hormone blocking pill that patients will take for minimum 5 years. But the issue with this is that in spite of everything that we just talked about, there is still a risk of the cancer coming back, short-term and long-term. And yes, early stage breast cancer is curative and curable, but with that real risk of the cancer recurring.
And what are some of the symptoms of breast cancer that women should be aware of?
So early stage breast cancer may not have any symptoms. Sometimes patients present with a lump in the breast or nipple discharge or skin changes or lump in the armpit, but more often than not, it's found on a routine mammogram where when you go in for your annual screening mammogram, they see a new density in the breast or new calcifications, which then leads to additional testing, imaging, and then confirms the breast cancer diagnosis.
So, Doctor, there's one other thing I want you to help me understand. Kisqali was approved by the FDA in combination with an aromatase inhibitor. What does that mean?
So aromatase inhibitor is a class of drugs that we use for the treatment of hormone receptor positive breast cancer. Kisqali was approved by the FDA based on the NATALEE clinical trial. This was a trial with over 5,000 patients with early stage breast cancer, a portion of who did not have cancer in the lymph nodes and a portion of who did have cancer in the lymph nodes. So when combined with hormone blocking treatment, which in this case was an aromatase inhibitor, it showed that there was a 25% relative risk reduction for these women who got Kisqali along with their hormone blocking treatment.
Asli, would you tell us about your early breast cancer diagnosis?
Sure. I found a lump in my breast and then had a mammogram and some other diagnostic testing, and which confirmed that I did have cancer, at which case I was referred to the Orlando Health team and Dr. Shah for treatment. And along the way, I asked a lot of questions and found out what options I had for treatment and what risk of reoccurrence would be with the different versions of the treatment. In my case, I had surgery as well as chemotherapy and radiation therapy. And there's always along the way questions about how to reduce those side effects from the different treatments. And then, of course, at the end of that, what would be the risk of reoccurrence? So I was constantly asking questions to keep informed.
Why did you make the decision to participate in the clinical trial? And also, if you would, tell us about the experience.
Sure. So Dr. Shah approached me and asked to tell me about the trial itself, and I read up on it and decided to participate, not only because it could help me reduce the risk of reoccurrence for myself, but also because hopefully it will help other people reduce their risk of reoccurrence of cancer, other patients in the future. So for those reasons, I decided to participate in the trial and followed the instructions that Dr. Shah gave me to be part of the trial. And things worked out well for me.
Clinical trials are without a doubt important, and so thank you for participating, because your participation has really helped to move the process forward to get this new treatment option for people with EBC. Dr. Shah, what does this FDA approval of Kisqali mean for people diagnosed with early breast cancer?
One more option now that patients can take to further reduce their risk of recurrence. And this is huge because you want to prevent a recurrence, because once there's a recurrence, there is no cure. So we want to do everything up front to prevent that cancer from ever coming back. So talk to your doctors, talk to your team about this new option.
And Audrey, what would you say to people who have been diagnosed with early breast cancer?
Well, I think there's always going to be anxiety along with any diagnosis of cancer. But what does help with that is getting with a team that you believe in, that you can ask questions, and getting answers that can help you, as I said, help reduce the side effects from treatment, and also find out about the risks with the reoccurrence and all of that. But mainly ask questions and follow the instructions of the doctors to help you get through the treatments. And in my case, I'm cancer-free, and I'm still going in for checkups here and there to make sure everything's good, but doing well so far.
Dr. Shah, where can we go for more information?
Well, thank you. And yes, early detection is the key. For more information on the NATALEE clinical trial, information on Kisqali, side effects, benefits, dosing, you can go to Kisqali.com.
Be sure to check out that website, and again, your doctor and your healthcare provider, to see if this is an option for you. Audrey and Dr. Shah, thank you very, very much for being here.
Thank you.
Thank you, Audrey.
I'm going to take a quick break. I'll be right back. Volunteer firefighters provide an invaluable service to local communities. Now there's a new documentary sponsored by John Deere, and it's putting a spotlight on the shortage of volunteer firefighters. Here's more about the film, airing this month on your local PBS station.
The goal of this film is to really highlight all the great work that volunteer firefighters are doing in their community. I don't think people often see it. You really are going to get immersed in the lives of these volunteers.
3/4 of the land mass in this country is protected by volunteer firefighters, and about 2/3 of the firefighters in this nation are volunteer.
These communities didn't have volunteers to serve and to respond to emergency calls. They would have nobody to answer 911.
If there wasn't volunteer firefighters, volunteer EMS, you could be waiting 30, 40 minutes before an ambulance could get to you, before a fire truck could get to you.
That's not acceptable. It's not acceptable to firefighters. It's not acceptable to members of the community either. One of the major challenges we have is in recruiting people to come on board the fire department.
Recruiting is a nationwide struggle right now. People are busier than what they used to be.
The demographic is aging, and it's aging rapidly.
The call volume has tripled over the past 30 years, so we need volunteers today more than ever. 70% of people don't even know if their department is volunteer or needs volunteers. So that is a big gap that we need to fill.
We're trying to make sure that communities and organizations there understand that we need help. This film and the assistance of John Deere in making this film will result in recruitment of new firefighters across this nation. I think we're going to see a groundswell of people who are going to realize the value of the volunteer fire service in their communities, and they're going to want to join.
I'm really hopeful that when people see this film, they'll see themselves in some of these roles and think, I might be able to do that, and that they will reach out to their local department and take that next step and see how they can also give back. And hopefully encourage and inspire some of those people that watch it to join up.
Check it out. I'll be right back. Welcome back. Clinical trials are essential to advancing healthcare, but historically, women, especially women of color, have been underrepresented in cardiovascular research. It's essential to have diverse representation in cardiovascular trials to ensure heart disease is accurately understood and effectively treated. Today, I'm going to speak with Dr. Roxana Mehran from Mount Sinai Health System, who's going to tell us more about the clinical trial process and how you can participate in local clinical trials, including Librexia, a comprehensive clinical program covering a number of cardiovascular diseases. Thank you so much for joining me, Dr. Mehran.
Thank you very much for having me, Audrey.
Tell us more about clinical trials, why they're important, and why it's important specifically for women and people of color to participate.
Well, first of all, really, really important that everyone understands what the clinical trial processes are like. Clinical trials are the way we answer questions whether or not a device or a drug is safe and effective. And it's a very, very I would say, well-oiled machine because it's been around for a very long time. There are standard procedures. If you qualify, you get into a clinical trial. The personnel talk with you. There is research personnel that work there with your doctor, and you get a lot of information, and then you're followed very, very closely. And of course, all of the, with phone calls or even with hospital visits or clinic visits to be sure that you're doing well. And it's the way we find out the potential of a specific drug or device of being safe and effective. So really important that we conduct these. But what's more even, I believe, more important is that these trials represent the patient populations that we're treating. If we're going to find out whether or not a device or a drug works, shouldn't it be in all patients, not just a selected group? And women and people of color are woefully underrepresented in these trials. For decades, we've worked, everyone has done everything they possibly can, but it's also up to the patients to get out there and say, is there a trial for me? Can I be included? Do I qualify? And that is another way of making sure that you're part of this important solution of improving human health across the globe.
Absolutely. Talk to us about the Librexia program and what health conditions are being studied as part of the trial.
Well, I'm a cardiologist, and cardiovascular disease is the #1 killer of men and women. So if for nothing else, everyone on this show should know that cardiovascular disease is the #1 killer for both men and women, and yet it is still under-recognized. There are 3 conditions that the Librexia program is focusing on. Atrial fibrillation, which is an abnormal heart rhythm. About 60 million cases are out there. So large numbers of patients are afflicted with atrial fibrillation. And atrial fibrillation has a high risk for stroke. About a quarter of strokes that we see are due to atrial fibrillation. So very important entity. The second one is people who present with a stroke, about 700,000 strokes per year in the United States alone. And then acute coronary syndromes or heart attacks are the other entity. About 50,000 patients will be included in the Librexia program that looks at these 3 different entities with 3 separate trials for the potential of hopefully reducing these complications of cardiovascular death, heart attacks, and strokes in these patients.
You mentioned earlier that diversity in clinical trials is important. It's my understanding, and please correct me if I'm wrong, that different medications work differently in different populations of people. Is that also another reason that it's important to have diversity in clinical trials?
Such an important piece, Can you imagine that you get a drug that's approved, and then my patient, a woman, a Black woman, will ask me, does this work on me? And was I part of these? Is this something that you're confident that it would work on me? And I'm not so sure that I have the answer for that question, because the number of Black women in these studies are extremely low. So do I really know the answer? And I constantly will have to say that, yes, I mean, the trial shows it, but you were underrepresented. Your type of a person was underrepresented in the trial. So I want not to have to say that again. And we absolutely, if we want to improve heart disease in women, heart disease in people of color, heart disease for everyone to be reduced, then we have to be inclusive of all patients. And we need to work very, very hard to be sure that our trials are representative of the population, especially right here in the United States.
Well, let's talk about the clinical trial process and what participants should expect when they enroll in a clinical trial, and if after they enroll and are accepted in a clinical trial, what to expect.
I think it's really important to know that clinical trials are usually conducted in places where there is really, really well-qualified personnel caring for these patients. And usually it's the doctor along with a research personnel who knows everything about the trial, and also with the doctor who's also participating in the trial. And so once you are qualified and you give your consent, your approval to be part of the study, after you've been fully informed and all your questions have been answered, then you're followed very, very closely by your doctor and the research personnel with phone calls and follow-ups, maybe coming into the hospital, making sure you're doing well, that you're taking the medications. Are you having side effects? Are you feeling fine? All of these things are recorded and reported and then evaluated. So that's how you are part of a clinical trial. And at the very end, when the trial is done with its enrollment and the follow-up period, then we have an answer to our question. And you could say you were part of that answer, part of that solution.
If someone is interested, Dr. Mehran, in joining the Librexia clinical trial, how can they enroll?
Well, for the Librexia program specifically, there's been a website put together called researchincludesme.com. Researchincludesme.com. That is a simple website to go to, and you will get a lot of information of why it matters to be part of a clinical trial. Why is it important to have diverse patient populations, to have women and people of color included? And then you will learn about the Librexia program and where in a hospital near you is participating in the program. And if you qualify, then you could ask to be enrolled in those trials.
Cardiovascular disease and stroke are the two leading causes of death and disproportionately impact women and people of color. So these clinical trials are really important, and we need to find ways to treat it that are inclusive of our population. So check out that website. Dr. Roxana Mehran from Mount Sinai Health System has been my guest. Thank you.
Thank you so much for having me, and thank you for including this topic on your fantastic show. Thank you.
There's more to come on Talk with Audrey after this. You're watching Talk with Audrey. Welcome back. The prevalence of food allergies in the U.S. has been on the rise for the past 20 years, and approximately 200,000 patients require emergency medical care for food-based allergic reactions every year. And with holiday gatherings just around the corner, many of us are going to be surrounded by treats that may contain some common food allergies like peanuts, tree nuts, milk, and eggs. And it's more important than ever for parents and caregivers and people living with food allergies to learn about the signs of an allergic reaction. So today we're going to talk about some of the ways to mitigate that risk and all you need to know. Joining me, the Chief of Allergy, Immunology, and Rheumatology Division of Rochester Regional Health, Dr. Shahzad Mustafa, and Margaret, whose 16-year-old son Matthew lives with food allergies. Welcome.
Thank you.
Thanks so much.
Thank you so very much for being here. Dr. Mustafa, food allergies seem to be on the rise. How do people develop allergies, and why is it important to talk about it now?
Yeah, so like you said, food allergies are on the rise. Food allergies are very different than a sensitivity or a food intolerance. Food allergy is an immune-mediated reaction to certain foods, like you mentioned, common ones being peanuts, nuts, milk, eggs, seeds, seafood. It's generally an immediate reaction within minutes. It can range from mild, itching, a rash, to life-threatening, something called anaphylaxis. They have been increasing, as have other allergic conditions. And today I'm here on behalf of Genentech and Novartis to discuss some exciting treatment options for food allergies.
Yeah, I mean, I know people who keep their allergy medication close by in case they have an allergic event. So, Halloween and the holidays around the corner, what steps should parents take to prepare for, say, safer trick-or-treating? And what advice do you have for parents of children with food allergies?
Yeah, so Halloween and the holidays are an exciting time, but they can pose difficulties for individuals with food allergies. So management always starts with strict avoidance of avoiding your food allergens, closely reading labels for foods, and always carrying medication to treat accidental exposures and reactions, typically epinephrine. But now we have some treatment options, which is really different than a few years ago. Some individuals may have heard of oral immunotherapy, or OIT. And in February 2024, the FDA approved Xolair, or omalizumab, which is a medication which is approved for children and adults over the age of 1 for management of food allergies, and any food, not just peanut, but peanut, milk, wheat. And what Xolair does, it blocks your allergic antibody, IgE. It increases the amount of allergen it takes to have a reaction. So hopefully, like you said, Audrey, it provides risk mitigation from reactions in the setting of accidental exposure when an individual is still strictly avoiding their food allergen.
So is this a treatment option that's injected?
Yeah, it's a great question. It's an injectable medication. It's dosed every 2 to 4 weeks, depending on the dose. Typically, dosing starts in a medical office with a healthcare provider, but over time there is the opportunity to potentially self-administer or have a loved one or a friend or a close one administer at home. And this is for risk mitigation. This is proactive therapy. You're going to still avoid your foods. You're going to still read labels. You're going to still carry emergency medications like epinephrine. But it is an opportunity to be part of the management option of food allergy.
Margaret, your son Matthew has allergies. What's his experience, and yours, by the way, because as a mom, it's not just his, it's yours too.
Exactly, that's for sure. Matthew was diagnosed with food allergy to peanut and tree nut when he was 2. But at that time, I really didn't have experience with food allergies, and I didn't realize how dangerous they could be. And unfortunately, he was exposed to peanuts and had an anaphylactic reaction. So it was really at that point that I recognized that we had to take this very seriously. And I think part of my mission has been to really help educate people around us on the severity of food allergies, that it's not as simple as just getting a tummy ache or some hives, that it can be life-threatening.
Well, when it comes to school and holidays like Halloween, are you on high alert, and is he on high alert?
Yes, and I can say now that he's older, that's a lot easier to manage. But initially, when he was younger, it was really our responsibility as his parents and extended family members as well to ensure that his environment was safe, and to also encourage him to advocate for himself and to not be embarrassed to tell people that he had a food allergy, because there's nothing wrong with him. It's just that he needs to be more aware of certain things than other people do. But I think over time, it's just part of who he is. It's part of the conversation he has with people when it's appropriate. And it's something that we as his family members continue to be vigilant about to ensure that his environment at home is safe, but to also educate him on how to advocate for himself outside in the world, especially as he's about to graduate high school in a year or 2 and move out into the world.
How is he managing his allergies now?
Strict avoidance, as the doctor said, that's first and foremost. And we work with his allergist on mitigating his risk, and Xolair is part of that for him.
Doctor, where can we go for more information on food allergies and to learn about treatment options?
Yeah, I encourage everyone with a food allergy, if you know someone with a food allergy, to speak to treatment options with their healthcare team with a board-certified allergist. You can also visit Xolair.com for more information.
Well, if you have little ones or big folks who are out there this holiday season and you have to watch their allergies, be sure to check with your doctor and your healthcare provider to see if this is something that might be right for you. Thank you both for joining me.
Thank you.
Thank you.
And that's it for this week's show. I'm Audrey Adams. Join me here next week for more insightful, intelligent, and inspiring conversations and information to help you improve the quality of your life. It's all about the business of living. I'll see you next week.
Oh.